Yes, ma'am. So after clearing my KAPS examination, I got 190 visa. Then after that, I came here in Tasmania and just started my internship. And right now, I have cleared all my intern hours and just waiting for my general registration. So everything's is finished.
So actually, with the how many points did you get visa for? Like for 190? Just I think many people here are interested about it. So
Yes, so I got visa at around 70 points. I think so. Yep, 70 points. For the written exam, I think if you have done like some mocks, as you have given us some mocks, so if you have practiced those ones and you know how quickly you can check AMH and find some answers in there, so
yes.
really helpful. Just
Hello guys, welcome to another video of Elite Expertise YouTube channel. This is Harika, practicing consultant pharmacist and a teacher of Elite Expertise, and I've got one of our interns who has successfully cleared his Intern Pharmacist written exam and oral exam, Pranav Garg, with us. He was also one of our KAPS qualified KAPS student of Elite Expertise before. So congratulations Pranav on your success. How do you feel about it?
thank you so much, ma'am, and thank you for teaching like you and sir. Because of you guys, I was able to clear both the exams. Previously as well, I have taken coaching from Elite Expertise during my KAPS examination as well. So thank you, and I'm feeling good. I'm about whichever I have planned, so I'm near to my goal. So I'm feeling good.
Amazing. So when did you clear your KAPS? I think it was in March 2023. Is it?
Yes,
1 year ago?
Yep, 1 year ago, ma'am. Yep.
And so you migrated to Tasmania, right? From Punjab, India?
Yes, ma'am. So after clearing my KAPS examination, I got 190 visa. Then after that, I came here in Tasmania and just started my internship. And right now, I have cleared all my intern hours and just waiting for my general registration. So everything's is finished.
Yeah. That was a bit of journey. I'm sure it's not as easy as he said. It was like a bit of struggle and pain and hard work. So what went well with your preparation, Pranav? And what could you do better? In terms of if you want to give some tips and tricks to the future intern pharmacists in their intern exam preparation.
Yep. So I have talked to my colleagues as well, few colleagues who are also completing their internship, but I have seen not very few preceptors are giving good training to their interns, but rest so they are not giving very good training and good knowledge about all the things which we should be getting. So I recommend to get coaching from you guys. I think it was very helpful because sir have told all the S3 products all part A exam. So I get to know about in detail about all the things and how to indicate how to know which symptoms they have, what it might be, all these things no one told us in detail. So they expect that we should know all these things, but but
true.
I really recommend to go in detail during internship. So after that, our life will be very much easier if we have in detail knowledge. So I really recommend to be good knowledge. So you can join coaching as well because it's really helpful for me. So,
More things actually. You talk about your experience, Pranav.
yes,
Okay.
I'm talking. Yeah. Yeah.
Yeah, so in-depth knowledge, definitely, I think the exam expects an in-depth knowledge and understanding, and it's not just for exam; it's for the independent practice as well as a pharmacist
Exactly,
later.
ma'am. Exactly,
Yeah.
ma'am. So after registration, so you will be working alone as a pharmacist. You have to make decisions by yourself. So if you have very good knowledge only, then you can survive. Otherwise, there are a lot of chances of error. So you might give some wrong product to someone. So in-depth knowledge is
Yeah,
really
true. When
important.
we're
So
dealing with the patient care, yes, true. When we are dealing with the patient care, it's very much important. We do the
exactly,
right recommendations, yes. And we are a responsible healthcare professionals, so we need to have right information. For that, we need right guidance too, definitely. Some people are very lucky; they get really good teachers in their internship. Some people they work in busy pharmacies, and it makes it harder for them to learn many things. And because we are overseas pharmacists, it's always challenging to learn a new practice orientation where Australian pharmacy practice expects a different setting, like it's a completely different setting where it expects like the expectations are different, the readiness is different, and then the exam pattern is different. So yeah, to get
exactly.
that exposure and then to be able to work as independent pharmacist in future, one needs in-depth knowledge, and that's what Pranav is suggesting for. So which section you found very tricky in the oral exam?
In oral exam, part C was like bit challenging one. Sometimes cases were really simple, but sometimes they just want answer in a specific way, like they wanted. Like if you told that this is the problem, but they will trick you what's the substitute and some other questions if you are not giving like in a right way or like they wanted. So they might fail. So I think part C is the tricky one. Uh, so part
Clothing and
A,
communication. Yeah.
exactly. Yes, so we have just limited conditions if we have studied all those things. So we might, there are we will get from those conditions only. But in part C, so any case can come. So we have to identify.
Yeah, I mean, like primary healthcare, we have set cases which are very popular among. I mean, like the primary healthcare is like more. We know our limits in pharmacy practice and what our scope is, and it's very easy to prepare. And legal and ethical part, yes, we know like how to cope up the legal ethical challenges, which is like a bit of like once we practice, we'll be okay. But the problem solving communication really needs in-depth knowledge and good practice, and then the time
Exactly.
management which plays a crucial role,
Exactly.
and
Time.
yeah, and the presence of mind in the exam as well, like how you're able to answer the question and how you're able to direct the exam towards the answer and solution, and then how you're able to communicate what's wrong, what went wrong with the patient and what could be done to make it better for the patient's health and well-being is being challenged for, and then that's what they expect you to be familiar with, and then mainly I think they check the independence, like how independently you can practice. If you're left as a locum without any guidance or anyone in a completely new setting, you should be able to show them that you are capable of practicing and handling a pharmacy. So I think that's what they're expecting in the exam, and that's what
Exactly.
makes
So
it hard. Yeah.
exactly. So you should be able to work independently and make decisions. So
True, true, true. So actually, with the how many points did you get visa for? Like for 190? Just I think many people here are interested about it. So
yes, so I got visa at around 70 points. I think so. Yep, 70 points.
70 points, yes, yeah. And then it's on your own, right? And then you have some points from state.
Yes, so after that I got I think 5 points from state for 190. I
I
think so. Yep, I think.
now
Yep, 5 points.
Tasmania. Yes. And
Yep.
how's life in Tasmania? How do you like it about? I think your family is there, right? Your
Yes, ma'am.
sister
I'm
and
living with my family. Yeah. So life is like pretty relaxing here. Like there's not much crowd and population is very limited. So it's like peaceful and it's surrounded by ocean. So it's beautiful here. So
so different. But anyways, I'm
exactly.
so glad and happy that you made it, and amazing result, written exam and oral exam. Any last minute tips and tricks for written exam, intern pharmacist written exam you want to give away?
For a written exam, I think if you have done like some mocks, as you have given us some mocks, so if you have practiced those ones and you know how quickly you can check AMH and find some answers in there, so
Yes.
really helpful. Just
Yeah, doing the mocks is important. Yes, mocks give you simulated
exactly,
experience.
yep,
I've seen
exactly.
actually.
So
Yeah, true. Yeah, people who don't do the mocks, I mean, like I've seen they didn't properly utilize mocks a couple. So, anyways, I think any mock like the mocks will give you some like real life simulation in the exam.
so most of things are in AMH, but like some things regarding like PBS guidelines or some other things. If you have solved some mocks, so you can easily, you don't need to open anything. You can just save your time and mark the right answer. So
True, true. And I think like with the calculations and legal and ethical parts of written exam as well, the
exactly,
mocks will give you like enough, enough practice. I think the calculations are very different to KAPS exam, right? It's more like patient-oriented calculations we get, BMIs and calculations based on compounding mixtures and all that, creatine clearance
exactly.
and stuff like that. It's a bit slightly different to KAPS exam calculations, I feel. Nice, nice. Okay, and congratulations, and soon to be pharmacist general registration waiting ahead for you. And I think you finished your ITP. Did you? ITP with
Yes,
PSA,
ma'am.
were you?
I'm just waiting for the result for that one. Rest everything is done. So
So it was
just
PSA,
last thing.
isn't it? Doing PSA.
Yes, it's from PSM.
Okay. Okay, thank you so
Yes,
much for coming down and giving an interview. It's so good and serene to see you. Thank you once again. All the best for your future. I'm sure you'll become a very big and awesome pharmacist. Thank you.
thank you so much, ma'am. Thank you, and thank you for like you and sir as well for like teaching us and guiding us. So thank you.
Thank you, dear.
Thank you.